Ram Chaudhary is one among many in his village who built a toilet in his house back in 2016. He bought the easy latrine from a local drink producer and installed it with a single pit. At the time of installation, he was informed that the pit would fill in 8 to 7 years. Today, after about 8 years of toilet installation, he is anxious about the next step. Over the last 10 years, Nepal has made significant strides in wash sector, mainly in eradicating open defecation. This has been made possible by a deliberate ODF movement that has lasted more than a decade and has been delivered with high levels of government engagement as well as the joint effort of multiple donors, INGOs, private sectors, and households. IDE, through its sanitation marketing initiative, implemented from 2011 to 17, had been an active partner of this movement and played a substantial role in increasing sanitation coverage rates in 8 Tarai districts from 27% in 2011 to above 80% in 2017. The program follows human-centered design approach to design the Easy Latrine, a cost-effective and aspirational tile slab which can easily be cleaned and includes many additional improvements, including lower transport and installation costs, longer use, and basic shelter options. Despite the successful execution of the Sandmark program, UNICEF could not continue funding and the project was concluded. A total of 113,982 latrines were promoted during the program period, which includes 62,592 easy latrines connected to the Sandmark program. Today, ODF sustainability is a growing issue in Nepal, with a slippage rate of about 5% at national level and 15.8% in Madhya province. The majority of the toilets constructed during the later ODF movement in Tarai's rural areas and small towns are not sewered and reliant on on-site sanitation systems such as single pits, double pits, and septic tanks. There is no accurate information on the current state of these pits. More information is needed to evaluate whether the on-site facilities, fecal sludge, and wastewater are safely treated. As per FEE research, open disposal in water bodies and community forests is a widespread practice for fecal sludge management in Nepal. Although desludging and disposal are practiced in fecal sludge management, treatment and safe disposal still continue to lag. Hence, it is without a doubt crucial to find a low-cost and purposeful fecal sludge management solution for rural households whose latrine pits have started to fill, not only to avoid rollback but also to correspond to the SDG goal of safely managed sanitation services. With the support of this Spark grant, we intend to carry out an action research examining the use and status of these easy latrines, their conditions and patenting processes, the plans that households have for when it is full, the options they've considered, and their willingness or capacity to pay for each option. Based on research and lessons learned from other IT country programs, this concept will identify realistic solutions for managing fecal sludge in rural households that are both affordable and aspirational. It will carry out a pilot in order to learn about seasonal effects on FSM, uncover consumer behavior preferences towards fecal sludge management, and access the marketability. This pilot project will also conduct formative behavior and contextual research in addition to product and sales testing. As large percentage of toilets built now are 5 to 10 years old and should now be close to filling, it is a very appropriate time to carry out the pilot study. As there are a significant number of single pit latrines, it is very critical that the households have alternatives for pit emptying before it's completely filled. Lastly, based on the success we have had in expanding improved sanitation coverage in the Rai region, this concept outlines IDA's vision for continuing to drive positive change in wash conditions in Nepal.